Why snoring might start in your mouth, and how dentists can help you sleep better. Snoring may be the butt of many jokes, but for those who live with it or sleep beside it, the consequences are no laughing matter. Beyond being a nightly nuisance, chronic snoring disrupts restorative sleep, impacts overall health, and even strains relationships. In fact, sleep divorces, couples sleeping in separate rooms, are becoming more common. While nasal blockages and allergies are well-known culprits, dentists are pointing to a lesser-known origin. Your mouth. Snoring could be due to many reasons like blocked nasal passages or allergies, but causes may also arise in our oral cavity, explains Dr. Nikita Motwani, specialist, aesthetic dentistry, and co-founder, Smile Concepts. Poor jaw alignment, restricted airways, an enlarged tongue, improper lower jaw position, and even obesity can contribute to airway obstruction during sleep. Dr. Manvi Srivastava, dentist, NIMS Medical College and Hospital, agrees, noting that snoring is often not just a nasal problem, but actually based in the structures of the mouth itself. She explains that jaw misalignment, whether an overbite, underbite, or a recessed jaw, can limit the airway, especially when muscle tone relaxes during sleep. This allows the tongue to fall back, narrowing the airway and triggering the vibrations we call snoring, she says. To pinpoint the exact cause, dentists employ a combination of advanced tools and assessments. We use investigations like CBCT imaging, intraoral scans, bite analysis, and even sleep studies to understand the abnormal factors, says Dr. Mahwani. Once diagnosed, we can create a customized oral appliance similar in appearance to a mouthguard that gently repositions the lower jaw and tongue to keep the airway open. Dr. Srivastava highlights that these mandibular advancement devices are non-invasive, simple to wear, and highly effective for mild to moderate obstructive sleep apnea. They not only help reduce snoring but also improve the quality of sleep for both patients and their partners. In cases linked to bruxism or TMJ disorders, reducing jaw tension and correcting dysfunction can also prevent portions of the airway from collapsing. She adds, swipe left for next video for more advanced cases. Dr. Motwani notes that CPAP machines remain the gold standard, but oral appliances are a preferred first line of treatment for many. Adjunct therapies such as aligning teeth with braces or aligners, jaw and tongue exercises to strengthen airway muscles, lifestyle changes like reducing alcohol intake, losing weight, and sleeping on one side can further enhance results. Ultimately, tackling snoring at its dental root doesn't just promise quieter nights, it delivers healthier mornings. As Dr. Motwani sums it up, when we treat the cause, not just the symptom, we give patients the gift of restful, restorative sleep.